Hello everyone, welcome to my channel. Today we have another psychiatry question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 20-year-old college student is brought to the emergency department by her roommate after being found unresponsive in her dorm nearly early in the morning. The roommate reports that the patient had been struggling with depression over the past several months and recently started taking acetopram. An empty prescription bottle that had contained a 1 month supply of medication was discovered on the bedside table, although it is unclear how many tablets were actually ingested or when the overdose occurred. The patient was last seen awake the previous evening before everyone went to sleep. On arrival, her temperature was 36.4, 97.5 Fahrenheit, blood pressure was 114/72, heart rate was 68, respiratory rate was 9 per minute, and oxygen saturation was 99% on room air. The patient is difficult to arouse. She opens her eyes only to painful stimulation, makes incomprehensible sounds, and withdraws from pain in all four extremities. Her clothing is soiled with vomit. Pupils are equal and reactive to light. Muscle tone is normal. Deep tendon reflexes are symmetric, and no clonus or rigidity is present. Cardiac, pulmonary, and abdominal examinations are unremarkable, and there are no signs of external injury. Which of the following is the most appropriate next step in management? To summarize everything, the patient seems to have taken too much SSRIs, and we seem to be dealing with a case of an overdose. But the patient is unconscious, she is responsive to painful stimulations, and makes incomprehensible sounds. Her temperature is okay, blood pressure okay, heart rate okay, but the respiratory rate is on the lower side. With that being said, let's read the answer choices. Start intravenous sodium bicarbonate. Well, sodium bicarbonate can be used for TCA, tricyclic antidepressant overdose, but that's not what we are dealing with here, because if you have TCA, you probably have some basically cardiac symptoms as well, including tachycardia, fever, but we are not seeing those here. So I'm going to say A is not the best answer choice. B, began treatment with cyproheptadine. Well, this could be helpful if we had SSRI, uh, basically toxicity, not SSRI toxicity, but serotonin toxicity, and the patient uh, is having an overdose, uh, probably due to the SSRIs, which are serotonergic agents, but we are not seeing signs of serotonin toxicity because the heart rate is normal and the blood pressure is normal too, and we are not seeing any hyperreflexia. So I would say B is not the best answer choice for now. C, administer activated charcoal. Well, activated charcoal could be used to deal with cases of overdose, or maybe if you have ingested something toxic. But the issue is you provide activated charcoal to a patient who is awake. You can't do that to a patient who's not awake. There are risks with that. So C is not the best answer choice. D, measure a serum estilopram concentration. So basically, measure the SSRI levels in the serum. Uh, Not the best answer choice because in most emergency room situations, you don't have access to SSRI uh, tools and measure SSRI levels, and also SSRI levels do not really correlate well with toxicity and mental states of the patients. So D, not the best answer choice. E, evaluate for possible co-ingested substances. This could be a good answer choice because with SSRIs, if you overdose on them, you don't see such severe reactions. And maybe the issue is not the SSRI overdose. Maybe there are other substances involved, and we need to check for that. So I would say uh, E is the best answer choice. If you like this video, please like and subscribe.